This is Fran Hoffman in Dr. White's Advanced Family Systems class, Spring 2015, and this is our video interview assignment. Okay.
Please summarize your chosen approach to family therapy.
I've chosen solution-focused brief therapy. It's a postmodern social constructionist approach, and the reason I chose it is that there's no universal truth involved. That's part of the postmodernist social constructionist theory, that each person constructs his or her own truth. So each person has their own reality that's informed by their own experiences and their own relationships. There's a big social component in this. So each individual's perspective is unique, valid, and equal to everyone else's. There's not a hierarchy. Like the therapist belief system is not held in higher regard than the client's. And postmodern approaches include solution-focused therapy, narrative therapy, collaborative therapy, to name some of them. But for the purposes of this assignment, I picked solution-focused therapy because it's the one I like the best. It's the therapy of choice right now from a mandated care perspective, and I'll talk more about that in a minute. It's a goal-directed, a collaborative approach that focuses on solutions rather than problems. It focuses on what clients want to achieve in therapy rather than what therapists want to achieve in therapy, which doesn't always happen. And it also focuses on clients' strengths and resources as agents of change during therapy.
What makes your chosen approach distinct from other approaches to family therapy?
Like I mentioned a minute ago, it focuses on solutions rather than problems. That's the biggest asset to the approach. One of the biggest things it does is it focuses on exceptions to the problem. And by that, I mean, suppose somebody comes in for therapy for depression, and they're talking about when they had the depression and what was going on. It's very problem-saturated talk. Exceptions are the times in their life when depression wasn't there, when they were operating and they weren't depressed and life was good. So you try to get them to look back in their life, dig out those times, and focus on what was going on differently in their life at that time. What were they thinking? What were they doing? What were they telling themselves? What were they feeling at that time in their life? And you try to build on those exceptions to get them to expand out into other areas of their life, to where the exceptions take over more than the depressed time, if that makes sense. It's different because it places a big value on client resilience and resources, as few other approaches do. Clients have all kinds of solutions built into themselves that other therapies don't even look for. They just focus on the problems. It honors individualism. In other words, clients are looking for their own solutions. There's not a cookie-cutter approach to what helps with depression. They're looking for their own solutions for that particular problem based on their own experiences. It instills hope. It helps clients stay true to their own reality. It honors their reality. It asks clients to envision their preferred futures rather than the problem-saturated past that they've experienced, which is different than most other approaches. And it focuses on small, achievable steps in achieving client goals. In other words, it's not just the big goal at the end, I want to not be depressed anymore. It's on individual incremental goals, which are very practical, and they help the client not lose faith in the process. It also compliments clients on persevering through difficult times, because clients come in with very difficult problems, and instead of just focusing on what's wrong, solution-focused therapy focuses on complimenting the client and helping the client realize how much strength they have for having gotten to this point so far, how they keep getting up every day. So it's just a different approach to therapy.
What drew you to this approach personally?
Well, there's a lot of overlap in the questions for the reasons that I just said. The reasons that make this approach different from other approaches, those are the reasons that drew me. Additionally, from a practical standpoint, this is the solution-focused therapy is the front runner right now for family therapy. Managed care wants therapy to be handled in a very efficient, expeditious fashion. Solution-focused therapy is typically 3 to 6 sessions, so it's very quick. It again focuses on solutions rather than the problems. It focuses on hopes and dreams of the client. It's positive rather than tell me what's wrong in your life. Again, it focuses on the incremental steps toward the goal, which help clients build belief in themselves that they can get there from here. It instills hope and changes the way families view themselves and problems, which is different from most other approaches. And the main reason that drew me to this is that I saw it work. I saw a video of Insoo Kim Berg doing this therapy with a family and saw the moment where it changed with the family, and I'll talk more about that in a minute. So I saw it work, and I really wanted to do it.
Can you give a case example in which this approach proved to be useful and describe how it was useful?
That was the case I was just talking about with Insoo Kim Berg. She's one of the founders of Solution-Focused Brief Therapy, and she was seeing a family who was there for mandated therapy. The father had a drug problem, and they had been in the court system for a while. They'd experienced family therapy in the past and had not gotten anything out of it personally. They were just there to do their time. The clients had always been, the focus had always been on what the clients were doing wrong. So that's how the session began, with what brings you here, what problems are you having in your family life. And it was clearly a well-connected family, but they were having issues or they wouldn't be in court, obviously, and family therapy would not have been mandated. But as soon as Berg got a feeling for the problem, then she started the hunt for exceptions. When was this not going on? What was going on in your family life then? And they started identifying times when they were connecting better and the problems weren't as bad, or they weren't there at all. And they started building on that. And they even said, no one's ever asked us what we've done right before. It's always been about what we've done wrong. And you just watch that moment change from they were there to meet the letter of the law to, okay, this is meaning something to us now. This is helping. And they got into it. And that's where I think this therapy differs from so many other therapies, and what really interested me in it.
Can you describe any key interventions associated with this approach?
There are several. The most well-known one is the miracle question. And that's where, after getting the background on the problem, the therapist asks the client, okay, suppose you went to sleep one night and the problem that brought you here is gone. But it happened during the night while you were asleep, so you don't know that it's happened. What would you see the next day that would let you know the problem was gone? So the person has to walk through their day saying, okay, I see this, I see this, I see this. They're very clear on what they don't want. The problem is all about the negative language, what they don't want. But this is the first time they're seeing their day without this problem. So it's very positive focused. And they see all the things in their life that they want. And that's the beginning of the dialogue of defining what you do want rather than what you don't want, which is the whole premise, the whole tenet behind solution-focused therapy. Another intervention used are scaling questions. Solution-focused therapy is all about questions. It's a series of different questions designed to do different things. Scaling questions are where you ask a client to scale where they are from 0 to 10 in different areas. They could scale where they are in depression that day. You suppose they say they are at a 5 that day. You could say, what would keep you from slipping to a 4, from a 5 to a 4 between now and next week? And then they focus on specific things, how they envision their world, what would their world have to look like to keep them from going back that point. So it's a way for clients to assess where they are. Another intervention we've talked about are the exception-seeking questions. When in your life was this not the case? When were you not depressed? Looking for the exceptions to the problems. Coping questions and compliments. Like I mentioned before, clients come in with very deep-rooted problems often, and they've been coping with things that you or I couldn't imagine coping with. And therapists compliment them on the resources it must have taken for them to get up that morning, for them to get here, coping with things that are very difficult. And another intervention is the big one, problem-free talk. You keep redirecting the conversation from the problem-saturated talk to solution-oriented talk to present and future-oriented talk. We don't care what happened in the past, other than to identify those exceptions. Now we're looking at the present and the future, so we stay on problem-free talk.
How would you describe this approach in one sentence?
I would say solution-focused therapy is a solution-oriented, goal-directed, collaborative approach that truly utilizes client resources and strengths to facilitate change. Thank you.